So, because we like internet, we actually believe, strongly believe, as you all have said, that that's the future and people should be involved. We thought about asking for some money so we would have some internet radio podcast. And we got $12,000, $12,000, yeah. If not, I will be so happy. My website will be working. I will have 3 people here with me. No, $12,000. And just to do a pilot of 12 shows. And the shows were for Latino gay men living with HIV in Ontario. So the idea was to think about a Latino man who lives with HIV, but he lives in Ontario, but not in a big city maybe. So people in Toronto, they have access to many clinics, they have access to services, there are places they can go. But if you live, I'm just gonna name a place, like, I don't know, Sudbury, or I don't know, and then you are Latino and you live with your family maybe, or with other people, but you cannot tell them that you're positive or that you're gay, and then you don't want to ask for services because you don't want people to see you, and then everything you need, you have to travel 3 or 4 hours to get access to. So that was our target. We said, let's create some radio, internet radio, that people could access in the safety of their home, they could use with their own computer, and let's create this, like, this community without walls. Like, people will connect, and actually, they could actually make like appointments with our counselor in Spanish, and they could have services like on the phone. So here were the 4 objectives. It was to reduce isolation, to provide relevant information, to promote the space for critical discussion and post-prevention condom use, to reduce the impact of discrimination and stigma, and to promote the services that we have at 40 Wesley in Toronto, which is the HIV prevention program. So what were the challenges? Well, we had to develop like ways how to measure that we were actually successful, like counting how many people were listening to the radio, to the podcast that we saved in a website. So the website, at the time, it was called to radioplus.podomatic.com. And here are the statistics of how many clicks we had with over 12 shows, and then we had the website for a year. Again, I didn't know because the other day I was looking for the website so I could come out with you, and then I discovered that the website was gone, or this address wasn't available anymore. And then I talked to my manager, and he said, well, because we had to pay, and after the project was finished, nobody paid. And I was like, okay, so this is gonna be interesting, because this is another project that it was great. We have saved the 12 radio shows, and I have nothing now to show you. So nevertheless, we said, you know what, let's go for funding. Let's create a pilot. Let's think more truly about this, how we can evaluate this. I went to talk to people at the OHTN. I talked to people in conferences. I said, like, you know what, this could be it. Let's get together. Let's get partnerships. Somebody who knows about computer, it's helpful. So we started training people in our intervention that it was called Mano en Mano. Now it's called Chicos.net. And then we started doing our own radio shows. And then we were just saving in the computer. So they are saving in a laptop in the office. So here are some of the things that we think are important, that you know this because you've been talking about that for the whole 2 days. Good evaluation takes time, work, and costs money. New technologies add new layers of complexity. Working with volunteers is very empowering, but it's also very challenging, because we had volunteers that they come and they want to create a website, but then they find jobs, so they move on, and then so the new person doesn't know how to work with that. So it's challenging. So like yesterday I was listening to him that they have all this army of volunteers, and I was like, wow, I need to talk to you guys, because that has been challenging for us to keep those people who are like very talented, engaged in the program, with the program. Also, the good thing, or the good feeling, is that everybody feels like, yeah, this sounds like a good idea. You should continue ahead. So we have this theoretical framework for the mano en mano model. That's the intervention. Now it's called Chicos.net, because the founders told us that we needed to create something new. So we changed the name, and we added art components. One of them is the radio. And so this is the theoretical model. Basically, it talks about the individual, how the individual is in a risk context, where it's impacted by the social determinants of health. And then here are the 4 things that we try to impact We try to reduce isolation. We try to increase HIV knowledge. We try to increase development of critical awareness. We try to increase resilience and self-efficacy skills. All these are recognized as factors or variables that are associated with condom use in literature, mostly from the States, because we don't have so much literature about Latino gay men in Canada. And then here are our scales that we, at this point, we still are testing. We're still testing the scales. We had the Ontario HIV Treatment Network conference 2 weeks ago, and then I have this big group, the same number as you are, with people from all over the country, and then we were just talking about which scales, how to implement the scales, how to make it effective at the community level, and we're still having that discussion. But that is our outcome, which is to reduce HIV infection to promote condom use. So with Francisco Ibanez Carrasco, he works at the OHTN. He used to work in British Columbia, so maybe many of you know Francisco. He is in charge of a project called University Without Walls. I don't know if you are familiar with it. They have this amazing kind of a fellowship where they get like 12 students from all over Canada, and they provide them with some seminars online. They use like this kind of a Skype. I don't know what is the system, but that somebody here, it's like just talking to a camera, and then 12 people are receiving this and they're discussing. And I thought, you know what? This is great. This is great. If we could do this, if we could get 12 leaders, 12 champions from Ontario, gay men who want to be trained, and then we provide them with these tools, educational tools, and they don't have to travel to Toronto to do that, that could be it. We can create this army of people who are skillful and who actually could come back to their communities and talk about safe sex, and then we can cover Ontario, first Ontario, and then Canada, and then the world. So we think very positive about this. And the second part of that intervention will be like, let them produce 26 podcast radio shows with different topics, themes, everything about prevention. I actually share the same philosophy that Kim was saying yesterday. Our founders there's still many ideas about HIV prevention is condom-based. I think that is well behind. We have to move ahead about thinking to an individual that is resilient, that is empowered, that has mental health, emotional, has access to sports, has access to friends, to a setting where he's loved, he belongs, safe. All these things are very important. So what if we can provide this with the radio show? So this is the model what we are trying to, and we discovered that there is a website called ASO 411, and they have it in English, French, and Spanish. And I told Francisco, I said, Francisco, if we could create these radio shows, this intervention, and we can just prove that by having all this radio show, we can get more people to go onto this website and access more services in Spanish, I think we could actually prove that the intervention is successful. So this happened last week, and this is basically the discussion I have with you, because then we started talking about methods and how we're going to make it relevant, rigorous, community-based, effective, cheap, blah, 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 blah. So this is what I'm having for you. What do you think about having an intervention online, radio podcast with people from the community, and how do we measure, how do we know if that is actually effective? And this is the end of my presentation.